we do see a lot of clients that are on the fertility journey with low AMH and high FSH having Hashimoto's. And now we're seeing more with Graves' disease as well. So I wanted to talk about this topic today, digging into the functional approach, functional nutrition approach with Graves' disease, and really, what do you do? Obviously, medication may be part of it, but how do we address those diet and lifestyle factors, take a very targeted approach, and really help reverse Graves' disease and get pregnant naturally? So excited for you to listen to this episode. Let's go. Hey, Dr. Osansky, excited to have you on the podcast.
Yeah, same here, Sarah. Thank you so much for having me. I'm excited to share some hopefully great information.
Yes, awesome. Yeah, I was on your podcast a little while ago. So definitely go and check that out. The name of your podcast again is escaping me. So sorry, go ahead and talk about that for 1 minute.
It is
I Save My Thyroid.
Save My Thyroid, yes.
There we go. Awesome. So yeah, share with us how you came to do this work. I know you have your own journey.
Yeah, so I guess it was 2008 that I was diagnosed with Graves' disease. And, so before that, had no experience at all with hyperthyroidism personally and with patients. I was just a regular chiropractor adjusting patients and actually took a break from my practice, actually sold my practice. So what I thought was be a permanent break, possibly from the healthcare field, but just was kind of unsure what I was going to do. And was diagnosed with initially hyperthyroidism. And the way that happened, I was walking in a Sam's Club and they have those automated blood pressure machines. And I decided to take my blood pressure. And my blood pressure was fine, but my resting heart rate was elevated. And, was a surprise because normally it was, in the either in the low 70s or mid 60s, so anyway, I kept on checking it the next few days, still remained high. So that's when I went to a primary care doctor, got the diagnosis of hyperthyroidism, eventually went to an endocrinologist and got the official diagnosis of Graves' disease. And again, at that point, I didn't have any experience with Graves, with hyperthyroidism. But I will say that when I was taking continuing education credits as a chiropractor, I always took credits related to nutrition. Even though I didn't practice a lot of nutrition as a chiropractor, like as far as supplements I did talk about diet, but I knew I was going to take a natural approach because I attended some functional endocrinology seminars a few years prior. And so, long story short, I was able to regain my health, get into remission, and have been in remission since 2009. And yeah, since then, I started working at that time, 2009. I started working with others with not only hyperthyroidism and Graves' disease, but hypothyroidism, Hashimoto's. I've written a few books since then, and as you mentioned, have recently since last year, 2021, my Save My Thyroid podcast, and that pretty much is my story.
Yeah, I had a doctor that's going to actually, her episode's going to be coming on the podcast shortly. And she was talking about if you're with a physician who has not had their own healing crisis, run out the door. I was like, well, that's an interesting thing, right? Because otherwise it's kind of like pushing the pill across the table or, not even knowing there's these other things to look at. So it's most people have had that kind of dark night of the soul, and then they've come and sort of attempt to walk the talk. We can never be perfect, but at least, not telling someone to do something that we haven't at least considered ourselves. And so let's talk about, so it's interesting. So a lot of couples that we work with, so they have low AMH and high FSH, premature ovarian insufficiency, diminished ovarian reserve. We do have many people with autoimmune issues, and typically it's more celiac or Hashimoto's, some rheumatoid arthritis, and MS. And then I said a while ago that we weren't having many people with Graves, and all of a sudden I'm like, it's interesting. We're getting more people with Graves. So if you could talk about, first of all, what's the difference between so first of all, why is it important to balance the thyroid when you're trying to conceive?
Yeah, well, thyroid hormone, it's very important. Pretty much every cell tissue in the body has thyroid hormone receptors. And the thing is, when doctors are evaluating thyroid hormone, especially if it is as you know, an infertility case, they typically, if they look at thyroid, they'll look and see if someone has low thyroid hormone levels. And it's true, if someone doesn't have enough thyroid hormone, that could cause problems with conceiving, or it could even cause problems with like miscarriage if someone is able to conceive. But the thing is also, the research shows, and I've seen in my practice too, that elevated thyroid hormone levels also can cause the same problems, can cause problems conceiving, and same thing can lead to miscarriages. So really, it's a catch-22. If you have low thyroid hormone levels, obviously not a good thing. If you have elevated thyroid hormone levels, also can cause problems conceiving or again carrying a baby. And then of course, thyroid hormone is important for the health of the baby after you conceive too, for brain development and, just, and then the autoimmune component too. When we think about most thyroid conditions, most hypothyroid conditions are Hashimoto's, most hyperthyroid conditions are Graves' disease. And again, the research shows that even that autoimmune component can play a role as well. Not so much, I'm not sure as far as conception, but definitely as far as carrying a baby. I know there's some research, and I spoke about this when during our interview, where there's a study that shows that increased thyroid peroxidase antibodies, which are common in both Hashimoto's and Graves patients, are associated with an increased risk in miscarriage. Typically when you have those increased TPO antibodies, more so you see hypothyroidism than hyper. But again, with Graves, it's common to have TPO antibodies as well. But yeah, just you want to have that balance. You don't want thyroid hormone level to be too low, but again, there could be problems if it's too high as well.
So let's just talk about the difference between hyper and hypo. Like what are we looking for? Sort of some signs and symptoms, and then maybe some looking at the panel. What are we seeing there? The thyroid panel.
Sure. So with hypothyroidism, when you have low thyroid hormone levels, think of everything slowing down. So you'll, have lower energy, you'll start gaining weight, you might have some brain fog. A lot of people have constipation, they'll have coldness is another common symptoms. And then hyperthyroidism, you get that increased metabolism. So things speed up. I mentioned that in my situation, I had an increased resting heart rate, I had palpitations, I had some tremors. Some people experience, instead of the coldness, like hot, almost like hot flashes, just our heat intolerance. And insomnia is common with the elevated thyroid hormone levels at night. I mentioned with hypothyroidism, you get a lot of times the constipation. With hyperthyroidism, sometimes you get the loose stools, diarrhea, and yeah, and sometimes you can get anxiety with both hypothyroidism, hyperthyroidism, but I see it more commonly with my hyperthyroid patients. So yeah, those are some of the differences with how people feel. And also I should say that, I mean, some people will have a combination, like they could go back and forth. I'm sure you've seen this, like some people with Hashimoto's might have transient hyperthyroid symptoms and might experience a combination, a fluctuation of those symptoms. So.
And then as far as looking at the TSH and the full panel, the antibodies, like what are you seeing then as far as because many people focus right on I've done many episodes on this and probably so have you. So just focusing on the TSH and not looking at the T3, T4, reverse T3. So what are you seeing there?
Yeah, so with hypothyroidism, you'll get the low thyroid hormone levels. Again, T3 and T4 are the main thyroid hormone levels. There's also T1, T2, but currently can't test for those. So with hypothyroidism, either T3, T4 will be depressed, or they might be on the lower side. I'm sure you or others or both, have spoken about optimal ranges, like lab ranges versus optimal ranges.
Mhm.
So someone might be on the lower side of the optimal range, but the doctor doesn't say anything about it. And you're right, most doctors will look at that TSH, which is thyroid stimulating hormone. And so that's a pituitary hormone, and it signals the thyroid gland to try to make more thyroid hormone in the case of hypothyroidism. So you'll see in the case of hypothyroidism that TSH will increase. And unfortunately, a lot of medical doctors, including endocrinologists, will just look at that TSH, and usually will just end up recommending thyroid hormone replacement and do nothing else. And then with hyperthyroidism, we see lower TSH. You have too much thyroid hormone. So you have elevated levels of T3, T4. And so the body wants to stop that production of thyroid hormone. TSH is like, okay, let's slow things down here. So you have, in the case of Graves' disease, most of the time you'll see undetectable TSH levels just because, again, it's trying to tell the body, trying to tell the thyroid gland not to produce any thyroid hormone. And so again, so hyper, low TSH, elevated T3, T4, hypothyroidism, you got the elevated TSH, low T3, T4, and then reverse T3 you mentioned. And so with T3 is the active form of thyroid hormone. And even though some T3 is produced by the thyroid gland, most of it is produced by the conversion of T4 to T3. And then we get reverse T3, which is the inactive form of T4, the inactive form of thyroxine. And so there's a little bit of controversy with reverse T3. Like some sources will say that it actually binds to the T3 receptor, blocking the action of T3. Others will say it's not doing that and it's just preventing the conversion, like inhibiting the conversion of T4, T3. But the way I look at it, it is in some cases a protective mechanism. Like in hyperthyroidism, I see reverse T3 elevated a lot, which makes sense because, let's say if it does bind to that T3 receptor, you want it to you want to prevent that binding of thyroid hormone in the case of hyperthyroidism, or if it's preventing that T4 to T3 conversion, again, you still want that in hyperthyroidism, but you don't want that in hypothyroidism. So on a blood test with hyperthyroidism, you might see T3. Actually, you'll commonly see reverse T3 elevated as well. And I honestly don't test reverse T3 anymore on my hyperthyroid patients because I expect to see that elevated reverse T3. But with hypothyroidism, you don't want to see that elevated reverse T3 because that usually means that there's a conversion problem, and it could be stress related.
Oh,
Chronic stress commonly will cause that. So yeah, you want to see that reverse T3 depending on the source. I like seeing it like 15 or below. Some doctors will want to see even lower, like 11 or 10 or in single digits. Definitely don't want to see it like above 20. I think most labs use a range like 22, 25 as the upper end. But those are the thyroid hormones and the reverse T3, and then there's the antibodies for both Graves and Hashimoto. So, I mentioned TPO antibodies, thyroid peroxidase antibodies, which are the most common type of thyroid antibody. And again, they're probably more closely associated with Hashimoto's just because they do cause damage. TPO, thyroid peroxidase, is an enzyme that's important in the production of thyroid hormone. So when you have the elevated TPO antibodies, that process is being inhibited or damaged, and so over time, that could lead to hypothyroidism. But it's actually quite common for people with Graves' disease to have those antibodies as well. So that's one type of antibody. And then there's thyroid stimulating immunoglobulins, or TSI, and those are more closely associated with Graves' disease. And those bind to the TSH receptors and what's responsible for the hyperthyroidism. And then we have anti-thyroglobulin antibodies, which are more closely associated with Hashimoto's, and thyroglobulin is a protein of the thyroid gland. So when you have those antibodies elevated, it's usually meaning that there's damage taking place to the thyroid gland, which again over time could cause hypothyroidism. And those are the main antibodies. There are other thyroid antibodies like TSH receptor blocking antibodies, but really those three are the main ones that are evaluated by doctors, and really the main ones that I look at in my practice.
okay, so let's kind of dig into the Graves' disease. So specifically, what are we looking for? So we kind of talked about kind of the different antibodies and things like there. So how would you go about um, maybe talk about your personal experience, kind of what you did with Graves' disease and what you see in your patients?
Yeah, so you mean as far as like some of the causes, or
Yeah, so some of the causes, and then also sort of, we'll talk a little bit more about some diet and lifestyle strategies towards the end. But like, what you're seeing with Graves' disease presenting to start with. I don't know if it's like, do you find that it's taking it, people are getting misdiagnosed with it, that it's taking a while to get diagnosed? Like, what are you seeing?
not really? I mean, we see that definitely a lot with Hashimoto's. Someone with Hashimoto's, it could take 10, 15 years at times for it to be reflected on the thyroid panel. Someone could have the autoantibodies, but it's not causing any changes, or they're seeing the TSH might be like 3.5, which we also spoke about, I
Yep.
think,
That
during
was
our
mine.
interview too. I think that was what you said
Yep.
yours was around.
Yep.
and and yeah, so most doctors say, "Oh, that TSH is fine. Don't worry about it." But that's a sign that it's not fine. And ideally, you would want to test those thyroid peroxidase antibodies. But most people don't know better. So if they see a TSH that's over 3, and if it's within that lab range, they probably are likely. I don't want to say get misdiagnosed, but they won't do more detective work to see, is it Hashimoto's, or do they have, even if it's not an official diagnosis of Hashimoto's, because they might not give that official diagnosis unless if TSH is above the range in the presence of those antibodies. But many times they won't even look at those antibodies. With Graves, I can't say commonly gets misdiagnosed, just because the symptoms are a lot more extreme. So like when I went to my primary care doctor, again, talking about elevated resting heart rate and palpitations. One thing I didn't mention with Graves' disease, a lot of people experience weight loss when we talk about the symptoms. And, I'm surprised I forgot to mention that, because I lost 42 pounds when I dealt with Graves. And not everybody loses that much weight. And actually, some people will gain weight, surprisingly. But with hypothyroidism, weight gain is common. Hyperthyroidism, weight loss is common. So when someone goes into doctor's office and maybe they didn't lose 42 pounds, but maybe they lost like 10, 15 pounds. They have an elevated resting heart rate. Some people have um, eye symptoms, which is called Graves' ophthalmopathy or
Yeah.
thyroid eye disease. So they might have like bulging of the eyes. But and I didn't have those symptoms. So even when went to my primary care doctor and presented with the symptoms I had at the time, the elevated heart rate, the weight loss, they right away tested thyroid hormone levels. And um, and you know and found out pretty quickly I had hyperthyroidism. And then when I went to the endocrinologist, they tested the antibodies. Some endocrinologists will do what's called the radioactive iodine uptake test, which, if that's elevated, that sometimes they'll use that to diagnose Graves' disease. I prefer people not to get that. I mean, it's not the end of the world if someone gets it, but the antibodies are pretty much conclusive. If someone has elevated TSI, thyroid stimulating immunoglobulins, and in the presence of hyperthyroidism, it's pretty much Graves. But yeah, so I can't say that it's commonly misdiagnosed. I have seen some cases where someone, like, I hate to say this, but some endocrinologists just don't have a lot of experience with Graves. So I've seen where they don't test the TSI, but they'll test those TPO and antithyroid globulin antibodies, just because I guess they're not familiar with TSI and they're so used to testing those other antibodies. But I've had a few cases over the years where they're hyperthyroid and they have those elevated TPO and thyroid globulin antibodies. And again, they could have the Graves' disease antibodies, but and in some cases they do, but in some cases the Graves' disease antibodies were negative, which suggests maybe that the person had like Hashitoxicosis, like had Hashimoto's with transient hyperthyroidism. So they might. I've seen that misdiagnosis for some people where they were diagnosed with Graves, but they didn't actually have Graves. And then there's subacute thyroiditis, which is caused by a virus, and that's definitely the person usually is hyperthyroid. And some doctors, again, won't do the antibody testing. They'll just look at the person, say they have hyperthyroidism, and just call it Graves. Um, and they might have subacute thyroiditis, which is transient. Usually, it self resolves over time. So definitely very different than Graves' disease.
What are you seeing around vision? So vision, yeah, you sort of think of that, the bulging eyes. Is there anything else around vision and Graves?
Yeah, so I mean, dry eyes is common just in general.
Yeah.
So that doesn't necessarily mean the person, has the thyroid eye disease, but it is pretty common, the dry eyes. But it's more specific are, yeah, the bulging of the eyes, the exophthalmos, the proptosis, some people do experiencing pain, that's swelling, and double vision, not as common, but it does happen. And that could be pretty debilitating if someone has double vision, especially if it's constant double vision. And yeah, so I mean, unfortunately, most people have thyroid eye disease. It's mild. A lot of people, when they're on Zoom, it's difficult to tell, which is a good thing, but then there are some people where as soon as they're on the call, it's obvious that they have thyroid eye disease.
Okay.
And, we got to think of it's still an immune system condition because with thyroid eye disease, it's those TSH receptor antibodies can attack the tissues of the eyes. And, so you still need to do things to improve the health of the immune system. And, as far as like another question people have sometimes as well, if I have like severe bulging of the eyes, can that be reversed naturally? And it really depends on the person. Honestly, when it's real severe, sometimes it can't be completely reversed naturally. And then it's up to the person. Do they want to look into surgery? Or there's a newer treatment that came out a few years ago called Tepezza, which involves infusions, getting infusions. I believe it's 8 infusions, like 3 weeks apart, and so that seems to work wonders with some people with thyroid eye disease. Only problem is potential side effects. Some people lose their hearing, which supposedly is temporary. Yeah, it's not permanent hearing loss, but still scary. And then it's still kind of new, so we don't know like what other side effects like 10 years from now, 15 years from now. But it is another option. I have had a few patients over the years since it came out get that, and I have seen some changes, in the eyes, like so people with bulging eyes, they got the Tepezza and that's helped. So I'm going to be biased. I'm going to say that, if it's not debilitating, to obviously try a natural approach. And, and obviously if it helps, then you don't have to do the Tepezza or, there's decompression surgery. But yeah, there is a time and place, obviously, for medical intervention, even things like steroids.
And then infusions, is that in the eyes or that's just in the body?
Oh no, not in the eyes. No, it's in the body. Yeah, just
Okay, I
like
was
in
like, oh
yeah.
my goodness, right in the eyeballs. That would
No.
be horrific. Um, okay, so we see a lot, obviously, with stress and then impacting the thyroid. I know for me, like personally, when stress goes too much for me, the hair starts falling out, and this I just find my thyroid medication, because I'm on thyroid medication, needs to be adjusted, and I got to go back doing all the things that I can do to manage stress. So why testing the adrenals? Why is that important for Graves and sort of the link with stress and Graves?
Yeah, so stress is huge. I'm pretty sure that was a factor in my Graves' disease development and a lot of the patients I work with. And yeah, just stress causes dysregulation of the immune system, and which could be a factor in the autoimmune response, a potential trigger. Stress also decreases secretory IgA, which lines the mucosal surfaces of the body, including the gastrointestinal tract. And in order to there's something called a triad of autoimmunity, which in order for autoimmunity to develop, there's a genetic predisposition, but more importantly, exposure to one or more environmental triggers, and then a healthy gut, or I'm sorry, exposure to one or more environmental triggers, or a leaky gut, an unhealthy gut, like an increased intestinal permeability. So stress could kind of be a direct trigger, but also could have a negative effect on the gut health, potentially be at least one factor when it comes to a leaky gut, and make someone more susceptible to developing an autoimmune condition such as Graves' disease. So yeah, and it's not just emotional stressors. Like before I was diagnosed with Graves' disease, I was overtraining. Of course, at the time I wasn't really aware of it, but now looking back, it was obvious that I was going to the gym and just really overdoing it. And when I was done with my workout, mentally it felt good, the endorphin rush and all that, but I was wiped out, and I'm sure that played a role as well. And my adrenal health. When I did my adrenal testing, which was through saliva at the time. We also spoke about Dutch testing, which I do as well. But for years, and I still do some saliva testing too. Actually, quite a bit of saliva, along with, I do Dutch testing too. But everything was low. My cortisol was low. My DHA was low. Actually, secretory IgA, what I just mentioned, that was low. So yeah, and I wouldn't have guessed it because that is the so-called adrenal fatigue pattern, which obviously there's controversy over the term adrenal fatigue. But when you think about that, you think, some people think about the adrenals being fatigued, but then they also think about you being fatigued. And I didn't feel fatigued at all. But part of that also, I'm sure, was because of the hyperthyroidism. When you get that increased metabolism, it kind of offsets, that fatigue. But yeah, I definitely recommend for pretty much all my patients to evaluate the adrenals. look at do either a saliva test. I like the Dutch test for those who want to dig deeper and look at the hormones, look at the metabolites. It is a really good test as well. Some people like to guess and just assume, hey, I know I'm stressed out, so my adrenals are not good. But again, I like to see the patterns. I like to see, is someone, in a high cortisol situation, a low cortisol situation, what does that DHEA look like, for example? So yeah, I'm all about testing, especially when it comes to adrenals.
Absolutely. Yeah. We see flatlined or we see people getting, yeah, before bed. It's sort of that second wind. Yeah, it's interesting with that to be able to see in black and white, like there it is. You maybe, because many people similar to me and you, like I wouldn't say I didn't feel stressed. I was good. I'm like, let's just keep doing more and more and more until the body's like, I don't think so. When I had that intestinal permeability, which we see a lot with the clients that we work with, right? That leaky gut, because maybe they've been on birth control or they've taken heaps of antibiotics like I did, or they had chronic stress for years. And so all of that is to see in black and white, we were like, okay, there it is. And then making those targeted steps to address it can be really impactful for your fertility. And
Yeah,
so we
that's a good point you made, Sarah, too. Like people, it's not just about me wanting to look and see like the patterns, but it's nice when the person sees themselves because honestly, when I did my saliva test back in 2008, when I was diagnosed with Graves, I didn't think my adrenals would look as bad as they did. So to me, when I saw the state of my adrenals, it was definitely a motivator,
yeah,
and it wasn't a motivator just to like take a bunch of supplements, but to start blocking out time for stress management and really start taking better care of myself.
absolutely, absolutely. Okay, and so what about iron deficiency? We see this with the link between that and thyroid imbalance. What are you seeing?
Yeah, iron is. I mentioned thyroid peroxidase earlier when we would talk about antibodies, but again, that's an enzyme that's important with the production of thyroid hormone, and it's heme dependent, which means it needs iron. So if someone's deficient in iron, they definitely could be, hypo. That could at least be a factor in hypothyroid. I can't say, I do see a lot of people with hypo. I'm sorry, I see a lot of people with iron deficiency. Now, I can't say that's the main cause of hypothyroidism, and the main cause, as we know, what most people is the Hashimoto's, the autoimmune component. But we can't dismiss nutrient deficiencies. Iron and amino acids such as tyrosine also play a important role in thyroid hormone production. But yeah, getting back to the iron, very common. I recommend an iron panel for everyone, and a full iron panel because unfortunately, some doctors will just look at serum iron alone. Some will just look at ferritin. But the thing is, and I'm sure you know this, ferritin could elevate in the presence of inflammation. It's an acute phase reactant. So if you just test for ferritin and if it looks good or if it's elevated, let's say you test for ferritin and if it's high, in triple digits, maybe like 400, you might say, wow, that person has iron overload. And they might, but also they might have a lot of inflammation. So really the only way you would know is by looking at the whole iron panel, the serum iron, the iron saturation, the total iron binding capacity or TIBC. And so in that situation, if ferritin is really high, but if the iron saturation is looking really good, let's say it's like, 35 and the serum iron is looking good, then it's probably not an iron overload. Now, if all three of those are elevated, and especially if TIBC is like low, then that that person probably has an iron overload. And then with the iron deficiency, same thing. Sometimes that ferritin, if they just test for ferritin, it might actually look good. The iron stores might not look too bad, but you might see the iron saturation low if you were to look at a full panel, or sometimes vice versa, where the iron panel, like the serum iron looks good, but the iron stores are low. So really want to look at the whole picture of that. And one other thing I'll add, getting to the iron overload, there is some evidence in the research that iron overload can be a potential factor in thyroid autoimmunity, more specifically Hashimoto's, at least according to the research. So you definitely don't want iron to be too low, but just as the case with thyroid hormone, you don't want it to be too low, too high with thyroid hormone. Same thing with iron. You definitely don't want it to be too low, but if it's too high, that could definitely cause a lot of oxidative stress.
Yeah, we see this a lot with women, right? So the low iron and then just, taking iron supplement, which is fine and dandy, but why is it low to begin with?
Exactly. Yeah, you got to look at, if it's cycling woman, of course that could play a role, but gut issues as well. I see that a lot. I'm sure you do too, where maybe like it's could be a cycling woman could also have a gut issue, but then especially if someone is in postmenopause or if it's a male, and if they're having low iron levels, then yeah, I'm definitely going to suspect, is there something wrong with the gut? If I'm working with a woman who's, 65, 70, and, of course you're not working with women that old, but, again, even in cycling woman age, you can't just assume it's the menstruation. I mean, if they have a heavy flow, yeah, that could be a factor. Very well might be the main factor or the only factor. But yeah, you can't overlook issues with the gut.
And what about zinc and copper deficiency? We see this a lot. We do a hair tissue mineral analysis test, and that can come back with, especially if someone's been on birth control or if they had a copper IUD, there could be too much copper, and then the balance gets off. But so, what are you seeing with zinc and copper imbalance and or deficiency?
Yeah, no, I agree. I see some of the same things as well. I mean, zinc and copper go together. So if you gave the example of someone having a copper IUD and that, driving up the copper levels, potentially leading to copper toxicity, which could be an issue. And, so in that case, definitely want to take enough zinc, but I guess also might want to consider, making a change with the IUD. Yeah, but yeah, I guess that's another story. Just trying to figure out the source of the copper. So it might not be the IUD, maybe it's the water, maybe it's another source. But yeah, you don't want it to, either one to be too high or too low. That's the thing with minerals, as well as hormones. We just spoke about that with hormones, and then again, I mentioned with iron, you don't want that to be too high, too low. And same thing, copper, if it's too high, that can cause oxidative stress. Be a potential problem. But if it's too low, you don't want zero copper. You don't want too much copper. Same thing with zinc. Obviously, you don't want too little zinc. You don't want too much zinc, but part of the problem, as you know, with too much zinc is that it could lower copper, which if you have a copper toxicity, it might be necessary to take the higher amount of zinc, to get the copper levels down while addressing the cost of the copper toxicity, whether it's an IUD or something else. But yeah, and then zinc, of course, very important for immune system health. So just in general, a lot of people with everything going on the last few years have been like loading up on the zinc and the vitamin C, and so yeah, and zinc also, I didn't say that also could play a role with thyroid hormone production too. And yeah, there's a lot. There's again minerals. You didn't ask me about this, but iodine, of course, is
Right.
very controversial in the world of thyroid health. And same thing, iodine. You don't want to have zero iodine. Some people are so afraid of iodine, and definitely could be problematic in higher amounts. But definitely, when conceiving, you want to, especially after you conceive, for the health of the baby, you don't want to, like, if you take a prenatal, I would hope that it has some iodine in there just for the health of the baby. But some people, especially with autoimmune conditions, Hashimoto's, Graves' disease, they're deathly afraid of the iodine. And again, I could understand because too much of that could be a problem. But like I said, with any mineral, you need that balance, and you don't want too little of it, and you don't want too much of it.
So what's your take on using it? I know personally I've used iodine. I don't normally have any problems with supplements. When I took iodine, man, I had like severe insomnia. It was like I took one drop, so I kind of shied away from it. But so what do you see kind of around with iodine and for your clients, patients?
Yeah, it's interesting. Years ago, a lot has changed with iodine over the years. Like when I was dealing with Graves, again, this was back in 2008, like a lot of practitioners were on board with like high dose iodine. And so I was one of those where just I learned at the conferences, that, yeah, if you have any type of thyroid condition, like supplement with iodine. And so yeah, I did take higher doses of iodine, and I had a good experience. Like I didn't have a negative experience, let's put it that way. Like it didn't do any harm. And, if anything, I think it might have been helpful, possibly. But it's hard to say because of course you're doing other things as well to improve your health. But then over the years I realized that it's probably not a good idea to, like put everybody on high dose iodine. And, to be fair, I did urinary iodine testing, to see if I had a deficiency. But still, iodine in excess could also cause a lot of oxidative stress, could potentially be a trigger. Um, so these days, what I do, I honestly I don't recommend I'm fine if someone takes a multivitamin or prenatal and it has iodine. I don't like steer people away from iodine and those types of supplements, but I don't tell people to take high dose iodine supplements. I even sometimes will see problems with high iodine foods like sea vegetables in some of my patients. So and again, is it so if someone tells you something, sometimes it's hard to know, is it up here because they might
Mhm.
have read about it. But sometimes if you see that relationship with the antibodies, like their TPO antibodies skyrocketed after they were eating large amounts of like sea vegetables,
Help.
again, could it have been something else? Yeah, maybe. But I guess so. My approach is a little bit different. I mean, I'm definitely not afraid of iodine. Like I think it is important. So I wouldn't say to completely eliminate it from one's diet. But from a supplement standpoint, as far as separate iodine supplements, I do exercise caution. I'm like, let's balance everything else first. Let's not, because even if someone's deficient in iodine, they could still have problems if they take separate iodine supplements like iodoral, for example. Taking selenium and magnesium, vitamin C can help offset some of those problems, but still, even with that, I've had people experience issues. So to me, it's not like the priority. It's not like, okay, like let's test your iodine, and then if you're deficient, put you on an iodine supplement. To me, it's let's look at other triggers. Let's look at let's change your diet. Let's make sure you're eating whole healthy foods. Let's do things to manage stress. Let's do some testing to look at your adrenals and find other triggers, other underlying imbalances.
So for Graves, let's dig into the specific diet and lifestyle recommendations. You talk about some of the testing and stuff you do there, but what are you what's your go-tos?
Yeah, so there's no perfect diet, as you know, for everyone. And so usually I am starting people on either a AIP, autoimmune paleo, or just a regular paleo type diet. Um, the AIP is a little bit more restrictive in that you're not supposed to eat the eggs, not supposed to eat nuts and seeds, and you're avoiding nightshades. What Graves, it is a little bit of a challenge because again, if someone's losing a lot of weight, they're concerned about restricting foods, and we're not telling them to restrict calories. We're still telling them to eat a nutrient dense diet. But again, some people might not mentally be ready for AIP, or they might have other issues, like if they have SIBO, small intestinal bacterial overgrowth. Usually, we'll address that first, try to get their gut in order, and it's really just too difficult to put someone on like a low FODMAP diet and to do an autoimmune paleo diet. So but again, some people will just start with even if they don't have SIBO, they might just start with a regular paleo diet and we'll see how they progress. So again, to me, diet is a starting point. Obviously, with everybody, I'm going to recommend go avoid gluten, avoid dairy, avoid grains. Um,
You just give us the final word. I've done many podcasts on gluten, but I still find sometimes people are trying to argue about the benefits of gluten if they have a thyroid issue. But what's the final word on gluten and dairy, maybe for people that have Graves or Hashimoto's?
Yeah, I mean, yeah, I don't see any benefit with gluten, but I mean, you could argue there's some health benefits with dairy, but the problem is it's a common allergen, a potential trigger, and you know how much does someone want to get better? I mean, everybody's different. So are there people that can maybe get away with some gluten or some dairy? I mean, yeah, I mean, obviously there people who have celiac disease, they definitely 100% need to be strict with gluten, or even if you have a non-celiac sensitivity. But it's not just about being sensitive, it also can increase intestinal permeability. It could cause that leaky gut. So if you're eating gluten while trying to heal, it's really going to be difficult, even if you feel fine. And honestly, I'm one of those people where, before I was diagnosed with Graves' disease, I had no problems with gluten. I had some problems with dairy, being more lactose intolerance. I can't say it was like a sensitivity, it was more that lactose intolerance. But still, just because you don't feel bad doesn't mean that it's not causing problems.
Right.
And to me, I'd rather someone I want someone to be more strict, and because again, there could be other triggers. So if someone, let's say, they go 3 months, into the diet and they're not feeling better, and they come back and they're like, I've been gluten free, dairy free, 100%. I've been eating whole healthy foods. Yeah, it's a little bit discouraging, but I'll say, well, if you're doing everything, that's great. Don't feel bad. I mean, it's important to eat an anti-inflammatory diet, but for many people, it's only a piece of the puzzle, and it might be other triggers. Whereas if another person was, after 3 months was like, yeah, I ate some gluten every now and then and didn't completely give up dairy. And, I was like, you know, again, they were just not completely sticking with the diet, then we just don't know. Then it's like if they're not improving at that point, it's like, well, you could have another trigger, maybe even multiple triggers, but we don't know if you didn't eliminate gluten, you didn't eliminate dairy, so yeah, I definitely recommend for people to, really everybody, not just those with autoimmunity like Graves, Hashimoto's. If I see, somewhat like toxic multinodular goiter, which is a non-autoimmune thyroid condition, hyperthyroid condition, I'll still tell them to, avoid the gluten. Well, at the very least, while restoring their health. I mean, once they restore their health, I mean, in a perfect world, we probably all should still avoid gluten, dairy. I mean, I'll be honest. I can't say that when I was dealing with Graves, I definitely avoided pizza. Now these days, being in remission, I can't say I'm 100% pizza free. And when I have pizza, I do have pizza with mozzarella cheese. I don't have like the dairy free pizza, and I seem to do fine with it. But some people don't, and some people it can cause a lot of inflammation. Maybe in some cases even cause them to relapse. So that gets a little bit tricky if someone is reintroducing some of those stronger allergens like gluten or dairy in the future. But for the sake of restoring one's health, I definitely recommend to strictly avoid them.
Yeah, it's hard when, in this case, they're trying to conceive, and sometimes people may not feel poorly, but then the body's like under attack somewhere, and that's why procreation's not working. So it can suck, but there's a lot of different alternatives to eat that you don't have to suffer. It's not about drinking green juice in the corner by
Yeah,
yourself. Yeah.
exactly.
So okay, so there's a diet piece. Any other lifestyle supplement? Anything other kind of your go-tos for Graves?
Yeah. So again, there's the diet. I mentioned the stress management. So when someone does adrenal testing, I do recommend supplements depending on like the pattern, which is one reason I look at the testing. Obviously, regardless of how the adrenals look like, yeah, we're gonna have people block out time for stress management. But the supplement choices very well may differ. But yeah, so it's stress management. I recommend daily stress management. I see a lot of people just blocking out like 2 or 3 times a week, maybe going to do yoga or even meditation. But I think it's something you should do on a everyday basis. And what I tell people, start with 5 minutes per day, just because everybody could do 5 minutes per day. And then I interviewed someone for my podcast the other day, and she's like, I'll even say beyond, like she said, do like if you can't find 5 minutes per day, do 10 breaths per day,
Mhm.
or just wake up and do like 10 breaths. But I guess my not my argument, but one thing I said also is if someone can find 5 minutes per day, they're the ones that need the stress management the
That's right.
most.
That's
So
right.
there's a problem there, a disconnect if you can't find 5 minutes per day. So there's that. And then I mean supplements, it does vary depending on the test. If I do I mean I will have people do some basics like omega-3 fatty acids because a lot of people otherwise will be deficient in omega-3s. And, I usually do recommend a good quality probiotic. And, selenium is really helpful for those with, thyroid conditions. But, I like to do testing and see what imbalances are in the test. If someone, if we do a GI map, which I know you do as well, and if we find H. pylori, then I'll put them on a protocol, an herbal protocol for H. pylori, or if they have parasites, or if they do another test, organic acids test or dried urine testing, and we've so really I try to base it on the testing. Now I will say for hyperthyroidism, we want to safely manage the symptoms. And a lot of people will choose to take the anti-thyroid medication, but some people will take an herbal approach. And that's what I did. So I took herbs called bugleweed and motherwort when I dealt with Graves' disease. And so that's also something I will give if the person, chooses to manage their symptoms naturally. I'll never tell someone not to take the medication. That's completely up to them. But if they make that decision on their own and they want to take the herbs, then I'll guide them through that as well. And yeah, that's it. Again, it differs, just like I'm sure with you. It's not everybody gets the same approach. I mean, diet and lifestyle, there's definitely a lot of overlap. But then when it comes to other things like, supplement wise, reducing one's toxic load, there are variations. Some people have mold toxicity. You might have to use some binders and, do other things to help in their situation.
And then, so with Graves and thyroid medication, so you were saying you're using some herbs, but like, what is your take on thyroid medication and Graves?
Yeah, again, there's a time and place for it. I took the herbs, but if I absolutely needed to take the medication, I would, because first of all, if you have elevated thyroid hormone levels, it could be a cardiovascular risk, but it also will have a negative impact on bone density. And so yeah, you definitely don't want to mess around with high thyroid hormone levels for too long. So if someone absolutely needs to take the medication, it's fine. I can understand why a lot of people don't want to take it, because the antithyroid medication does commonly cause side effects. And it's a bummer if someone takes it and they get those side effects. And it could be symptom wise that they get certain side effects like dizziness or rashes, or gastrointestinal upset, or it might reflect on the blood test. Like a lot of times the antithyroid medication will raise the liver enzymes, and the doctor, if the prescribing physician sees that, they'll take them off the medication. They might switch them to a different type of antithyroid medication, maybe like go from methimazole to PTU. But the thing is, usually most endocrinologists will recommend one of three treatments for the hyperthyroid patients: either the medication, radioactive iodine, thyroid surgery. So I know if it were up to me and if I had to choose between one of those three, I would definitely try the medication, because again, that's the name of my podcast, Save My Thyroid. So I would try to avoid the surgery, avoid the radioactive iodine if I could. There's a time and place for surgery. So I'm not saying that everyone can save their thyroid. Unfortunately, that's not the case. But I would say most people with Graves can save their thyroid. And that's where the medication is. You got to think, if you're on the medication, you're tolerating it well. You just got to think about it as, just it's a way of keeping safe while trying to address the cause of the problem. And a little bit different scenario with Hashimoto's, because we're looking at thyroid hormone. So when someone like takes thyroid hormone replacements, there's no herbal replacement for thyroid hormone. And some people do need to be on that long term. With antithyroid medication, it's usually not like permanent. Usually, someone might need to be on it for a year, year and a half, 2 years, but the goal is to try to address the underlying cause, so the person hopefully won't need to take it and will be able to avoid the radioactive iodine and thyroid surgery.
Yeah, so yeah, it's just a band-aid by itself, but looking at all the other things though that we're doing to optimize health and thyroid instead of the conventional medicine. It's like, here's the medication, we're gonna rip out the thyroid, or yeah. So dig deeper is the key. And so anything you're obsessed with right now, be it a book, a documentary, an app, anything you personally are loving?
I actually just finished reading, you know, s- and Cynthia Thurlow. I
Yeah.
actually interviewed her, so I've been reading the intermittent fasting book,
Mhm.
and and again, I've been doing intermittent fasting, but it's funny. Like also, I've been just making sure I'm getting enough protein. And so just that's another thing with hyperthyroidism. I'm not hyper anymore, but like people with hyperthyroidism, they don't want to, probably don't want to fast if they're losing like 20, 30 pounds. But then for, in the future, and I don't know if people who are trying to conceive, if they ask you about like, is it
Yeah.
okay to fast, and what your response is. But I guess my response is, it could be a stressor if you're doing it. Like there's, I spoke with someone a few weeks ago, and they were having one meal a day. And I'm like, you can't possibly be getting enough protein in just one meal a day. And so you got to be careful. So I'm reading, her book, and she during an interview we spoke about, like I made sure to ask her the question about the protein, and she, because I know to her it's important too, and she recommends like the 16/8 fast, but also make sure to get enough protein. So yeah, I'm still I'm finishing up, reading her book. And yeah, I guess that's the main thing. Like you, I'm always keeping busy with my podcast, and seeing patients and other things as well.
Great. Yeah. Yeah, for the intermittent fasting, there is a podcast episode I did on that. So it's not always right for people that are trying to conceive to go so long, right? Sometimes men can do a little bit longer than women that are cycling. So it is to really to figure out what's right for you. And then you've got a free checklist here, and I'll link the URL in the show notes. What can they expect in the free checklist?
Yeah, so the checklist, it includes 12 action points, mainly for those with Graves and Hashimoto's, really helping them to find or remove, their triggers. Also, it's also talks about like food triggers. Speaking of triggers, and talks about ways to enhance the elimination of environmental toxins from the body. Talks about the gut, addressing like gut and stealth infections, using something called a 5R protocol. Other things you can do to reduce chronic inflammation. So yeah, it's actually, so when people think of checklists, they think of sometimes one page. It's actually a multiple page checklist, so packed with a lot of information.
Great. And so, what are some final thoughts you have here on our topic today, Graves, and people that are on the fertility journey? Any final thoughts from you?
Yeah, again, thyroid hormone, once again, very important. So you want to get that balance. You don't want it to be too low, too high. But you, of course, want to try to address the cause of the problem. There's a time and place for the thyroid hormone replacement or anti-thyroid medication, depending if you're hypo or hyper. And so, definitely not discouraging people from taking that. But as we've been discussing, we want to try to find them balances. If someone has adrenal imbalances, which a lot of people do, if they have gut imbalances, which a lot of people do, nutrient deficiencies, which a lot of people do, those could be factors too. And if all you do is take the medication, yeah, it might help. And you might go to the doctor and say, "Hey," or you might get a blood test and the blood test looks good. Again, is it looking good from an optimal range, though? That's one thing you got to ask. But, and even if thyroid hormone's looking good, you also still need to address other deficiencies that might not relate to thyroid hormone. Again, two things to heal the gut, the adrenals, reduce your toxic load. So all these things are important. And I would say that if this sounds overwhelming, start with diet and lifestyle. Everybody could start eating healthier. It doesn't mean you have to follow an autoimmune paleo diet right away, or even a regular paleo diet. Try to start with eating more vegetables. Just or cutting out some of the refined foods. Block out time for stress management. Try take that 5 minutes per day. Get in that routine to do some meditation, yoga, or whatever you're willing to do.
Love it. Yeah. Bottom line, dig deeper. And, if you've been told things are normal, especially when you're trying to conceive, and dig deeper to make sure, looking at the full panel, making sure nothing's been missed. So thanks again, Dr. Eric, for coming on and sharing your words of wisdom on this topic. I appreciate it.
Yeah, thank you so much, Sarah. Appreciating you having me.